diagnose a duplication cyst by EUS aspiration because they need like the wall to show like the muscular coating and the epithelial lining.
So probably resection then in those cases.
Yeah.
After seeing your case, I almost want to recommend resection in this case. The second case is a patient with NASH cirrhosis. It's not cryptogenic cirrhosis, it's NASH cirrhosis. And the patient had these lesions on the bar. So these are they're multiple small lesions, and they're highly restrictive, as you can see on DWI. It doesn't enhance, but here on the venous face, it's hypoenhancing, these little dots everywhere. Any thoughts from anyone about what these?
Oh, you mean
NASH cirrhosis. They were screening for HCC, otherwise asymptomatic.
Is the portal vein open? I feel like I saw a thrombus, like in the intrahepatic portal vein.
Yeah, I see what you're saying here. It looks like there's a linear thrombus.
I was just wondering about like abscesses and like pilophylvitis and stuff.
Mm-hmm. Patient is asymptomatic. That's a great DDX. Clinically, he didn't have evidence of infection.
That left portal vein is thrombosed.
It's gone. So here.
And yeah, into them, yeah, like the whole left portal vein is gone.
Mm-hmm. Would you think about something specific because of the portal vein findings?
Well, obviously with cirrhosis, you want to make sure it's not tumor thrombus. But otherwise, it's frequent to get, if you get abscesses, to have also associated septic thrombus of the portal vein.
I call this LRM. Clinically, he didn't look like he was infected, so I didn't raise infection as a DDX, and I recommended biopsy. So the patient went on to get a biopsy, and it came back as lymphoma. So lymphoma, there's two types. There's secondary lymphoma of the liver, which is more common, usually multifocal, diffuse, or miliary. He didn't have evidence of, this was a new diagnosis of lymphoma. There wasn't lymphadenopathy anywhere else. The spleen is big, but it could be big from cirrhosis, not necessarily lymphomatous involvement. So I'm not exactly sure. I think they're still trying to figure out. The second type of lymphomatous involvement of the liver is primary hepatic lymphoma. These are rare, and in 60% of the time, they present with a solitary mass, although you can have multiple nodules as well. I guess the way that you confirm it is if you don't see distant involvement after 6 months, then they consider a primary hepatic lymphoma. This was a new diagnosis, and we don't have a 6-month follow-up yet, so I'm not sure if it's primary or secondary. Probably secondary, given sort of statistics. Anyways, some studies have shown that DWI, you get significantly increased restricted diffusion on DWI, and it is as sensitive, probably the most important sequence, but it's as sensitive as PET-CT for assessing presence and extent of lymphoma. I don't know that I would have called it ever in prospectively. It didn't look like HCC or anything typical, so I just gave it an LR malignant, which went on. Okay. The third case is...
It's the SALT differential, right?
Yeah.
Sarcoidosis was on that list along with TB and, right?
But I'm careful about, putting these esoteric diagnoses because I don't want...
I think it. I don't always say it.
I think it's like a diagnosis of biopsy, basically.
Yeah.
Every time I have lymphoma in the liver, we never called it that.
The last time I saw stuff like that was in the spleen, and it turned out to be granulomatous disease, felt to be sarcoid, even though the patient didn't have sarcoid elsewhere. So they sneak up on you. Yeah.
Whenever I see splenic lesions, I always just ignore it or call it benign.
I wonder if the thrombus was related to congestion though. Maybe there's a lot more infiltrative lymphoma in the liver because usually we're only seeing the tip of the iceberg. And then maybe it was congested, and that's why the portal vein thrombosed.
Yeah, that's a very good possibility. And I mean, it's on the DWI. I mean, there are a lot more lesions on the DWI than we can see on the contrast enhanced phase. So yeah, that could be, maybe congestion could be the reason for the portal vein thrombosis. I don't know. My third case is